In this section, we will talk about the superficial muscles. Keep in mind, though, that the body contains over 600 muscles, all of which can't be shown here. Let's name them: temporalis, orbicularis oculi; zygomaticus, orbicularis oris; deltoid, biceps brachii; brachialis, rectus abdominis; internal oblique, external oblique; transversus abdominis; brachioradialis; iliopsoas; frontalis; masseter; sternocleidomastoid; pectoralis major; serratus anterior; linea alba; sartorius; adductor longus; adductor magnus; tibialis anterior; fibularis longus. Moving towards posterior: teres minor; teres major; trapezius; deltoid; triceps brachii; latissimus dorsi; external abdominal oblique; gluteus medius; gluteus maximus; adductor magnus; gracilis; hamstring group; soleus; and Achilles tendon. Now, let's discuss muscles of the head and neck. Muscles in this region are typically grouped according to their function: muscles of facial expression, muscles of chewing called mastication and swallowing, and muscles that move the head. Of all the muscles of the face, the area around the mouth is the most complex. This makes sense considering that the mouth is the most expressive part of the face. The movement of the lips is also pivotal in the formation of words. First is the muscles of facial expression, which includes frontalis, that raises the eyebrows when glancing upward or when showing surprise. Other is orbicularis oculi, which is a sphincter muscle that closes the eye when blinking or squinting. Then zygomaticus, which draws the mouth upward when laughing, and orbicularis oris, which closes the mouth and purses the lips, such as when kissing. Last is the baccinetto, which assists in smiling and blowing, such as when playing a trumpet or whistling, as well as chewing. Other are the muscles of chewing, which includes temporalis, which aids in closing the jaw, and masseter, which closes the jaw. Last is the muscles that move the head, which includes sternocleidomastoid, which flexes the head, so is sometimes called the praying muscle, rotates the head to the opposite side when only one muscle contracts, and trapezius, which extends the head, such as when looking upward, and flexes the head to one side, also elevates the shoulder. The face contains over 30 muscles, which allow us to express a variety of emotions. And the human face is considerably more expressive than the faces of other mammals, all due to the wide variety of facial muscles. Besides contributing to facial expression, the muscles of the face allow us to speak, chew, and perform other oral functions. Almost every muscle of the face is innervated by the facial nerve. Consequently, an injury or disorder of the facial nerve can cause paralysis on one side of the face. For example, a viral infection of the facial nerve, called Bell's palsy, results in paralysis of the muscles on the affected side. The muscles on that side of the face droop, and those afflicted have trouble eating, drinking, blinking, or forming any facial expression, such as smiling, grimacing, or raising eyebrows. Other are the muscles of the trunk. Well, some of the muscles of the trunk participate in respiration and form the abdominal wall. Additional muscles support and allow movement in the vertebral column, while several other muscles lie on top of each other to form the pelvic floor. Now, moving towards muscles involved in breathing. Muscles are the driving force behind our ability to breathe, which includes external intercostals that lie superficially between ribs, elevate the ribs during inspiration, and diaphragm that enlarges the thorax to trigger inspiration, and internal intercostals that lie deeper than the external intercostals, depress the ribs during forced exhalation. Next are the muscles forming the abdominal wall. Whereas the trunk receives support from the skeleton, the abdominal wall derives its strength from alternating layers of muscle. The muscle fibers in each of the three layers forming the abdominal wall run in different directions, downward and anterior, as in the external oblique muscle, the most superficial layer, upward and anterior, as in the internal oblique muscle, the next layer, and horizontal, as in the transverse abdominal muscle, the deepest layer, which includes external oblique, that compresses the abdominal organs, which aids in forceful expiration, vomiting, and defecation. Also allows flexion of the vertebral column and rotation, and lateral bending of the trunk. The aponeuroses of the muscles forming the abdominal wall meet in the midline of the abdomen, where they form a tough band of connective tissue called the linea alba and rectus abdominis that flexes the lumbar region of the spinal column to cause bending forward at the waist, extends from the sternum to the pubic bone, and transversus abdominis that compresses the contents of the abdomen, and internal oblique that stabilizes the spine and maintains posture just like the external oblique muscles. Also permits rotation of the waist. Moving towards muscles of the shoulder and upper arm. The shoulder and upper arm perform a wide variety of movements. Some movements, such as throwing a ball or swimming, require power and a full range of motion. Others, such as writing, depend upon more subtle movements. To make these motions possible, the shoulder draws on a complex variety of muscles. A few of those muscles are deltoid, that abducts, flexes, and rotates the arm, involved in swinging the arm, walking, or bowling. Also raises the arm to perform tasks such as writing on an elevated surface. And pectoralis major, that flexes and adducts the upper arm, such as when climbing or hugging. And serratus anterior, that drives all forward-reaching and pushing movements, pulls the shoulder down and forward. On posterior side, muscles are trapezius, that raises and lowers the shoulders, stabilizes the scapula during arm movements, and latissimus dorsi, that adducts the humerus, extends the upper arm backward, such as when rowing or swimming, serves to pull the body upward when grasping an object overhead, such as when climbing, and rotator cuff. The tendons of four muscles attached to the scapula form the rotator cuff. They are the supraspinatus, infraspinatus, teres minor, and subscapularis on the anterior scapula. Nicknamed of these muscles are the sits muscles, derived from the first letter of names for each of the muscles. The tendons of these muscles fuse with the joint capsule and form a cuff around the shoulder joint, helping to hold the head of the humerus in place. Now, let's discuss the rotator cuff injury. The shoulder is the body's most mobile joint. Along with this great mobility comes a tendency toward injury, in particular, a fall or hard blow to the shoulder, or repetitive use of the arm in an overhead motion, such as by baseball pitchers, tennis players, weightlifters, and swimmers, can injure the muscles forming the rotator cuff. Overuse can also cause one or more of the tendons to become inflamed, resulting in pain. If the inflammation happens repeatedly, the tendon can degenerate and eventually rupture. Moving towards muscles that move the forearm. The muscles that flex and extend the forearm are located on the humerus, which include brachialis, which is the prime mover when flexing the forearm, and biceps brachii, that assists the brachialis when flexing the forearm. Also flexes the elbow and supinates the forearm, such as when opening a bottle with a corkscrew, and triceps brachii, which is the prime mover when extending the forearm, and brachioradialis, that helps the brachialis, and the biceps brachii flex the forearm. And pronator muscles allow the arm to pronate. And a supinator muscle, not visible here, lies deep in the forearm near the elbow. It joins forces with the biceps brachii to allow supination. A bulging biceps brachii symbolizes upper arm strength. Even so, the brachialis, which lies underneath the biceps brachii, is the prime mover for flexing the elbow. Now, let's discuss what is carpal tunnel syndrome. So, near the thumb is a narrow passageway surrounded by bones and ligaments called the carpal tunnel, tendons that allow finger flexion, as well as a key nerve of the hand called the median nerve pass through this channel. Difficulties arise when repetitive flexion and extension of the wrist triggers inflammation and swelling in the sheath surrounding the tendons. Because the carpal tunnel can't expand, the swelling presses on the median nerve, which produces tingling, weakness, and pain in the thumb, index finger, middle finger, and middle side of the ring finger. Called carpal tunnel syndrome, the disorder commonly afflicts those who spend long hours at computer keyboards, although any repetitive wrist motion may trigger the condition. Now, let's discuss the muscles acting on the hip and thigh. Unlike the arms, which are geared for free movement and precise maneuvers, the legs are built for stability and power. The muscles of the hip and thigh enable the body to stand, walk, and maintain balance. Consequently, this area contains some of the body's largest and most powerful muscles. The iliopsoas flexes the thigh, acting in opposition to the gluteus maximus. The term iliopsoas refers to a combination of the muscles iliacus and psoas major. The sartorius is the longest muscle in the body. It aids in flexion of the hip and knee, such as when sitting, and abducts, and laterally rotates the thigh, such as when sitting cross-legged. The sartorius muscle has the nickname tailor's muscle, supposedly because tailors sat cross-legged while sewing, supporting their work on their knee. The adductor muscles rotate and draw the thigh in toward the body. This group consists adductor magnus, adductor brevis, adductor longus, and gracilis. The quadriceps femoris, the most powerful muscle in the body, is the prime mover for knee extension. It consists of 4 muscles, although only 3 are visible here. The fourth, the vastus intermedius, lies underneath the rectus femoris, vastus lateralis, and vastus medialis. Now, let's discuss the muscle on posterior side. The gluteal muscles consist of 3 muscles: gluteus medius, abducts and rotates the thigh outward; gluteus maximus, the bulkiest muscle in the body. It produces the backswing of the leg when walking and provides most of the power for climbing stairs; gluteus minimus. This muscle lies beneath the other 2 gluteal muscles, where it assists the gluteus medius in abducting the thigh when the leg is extended. It also aids in both internally and externally rotating the thigh. And the hamstrings are a group of muscles consisting of 3 muscles: biceps femoris, semitendinosus, and semimembranosus, all of which work to extend the thigh at the hip, flex the knee, and rotate the leg. You can easily feel the tendons of these muscles as the prominent cords on either side of the back of the knee. Severing the hamstrings makes someone immediately immobile, which is why ancient mites would use their swords to slice the back of an opponent's thighs. The gluteus medius is a common site for intramuscular injections, particularly if the amount of medication to be administered is more than 2 to 3 milliliters. If 2 milliliters or less is to be injected, the deltoid muscle is often used. So this was all for today's video. Stay tuned to sqadia.com for more precise and knowledge-stuffed videos.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.